We're ready. Good morning, or is it good afternoon? Welcome, everyone. Before we start, I'd like to introduce Grand Chief Leo Friday of the Mushkegowuk Council to open in prayer.
Hare Mushkegowuk Hogetsumandu Nutaigishukaitain. Shawel Chegowuk Kichibechi milia hageta electamen. Nesta kichuichi guyak paleketchak. Ekiskinutayyak nesta tebelek taknitinani. Nesta jagomenagachi guyakion etutamak. Yabachegesingdilimenani. Amen.
Thank you, Grand Chief. At this time, I'd like to introduce National Chief Cindy Woodhouse Nepinak to open this time. Thanks.
Miigwech, Doctor. I want to thank each and every one of you. I also want to thank the press for making sure that the messaging, these important issues that face First Nations people are echoed out there to this country and to all levels of government. I know that your work is important, and I want to thank you for listening to our people today. And sometimes Canadians enjoy good hospitals, access to the internet, and basic things that Canadians take for granted. Many times our First Nations people don't have access to those same things. And we want to work with each and every one of you. We want to work with provinces and territories, as you see here today, with our leadership. And we want to work in a good way to make sure that the quality of life of our children are the same as your children, that they have the same footing, that they have access to clean drinking water, access to good health care, access to good education. We want what every Canadian parent wants for our kids, and that's a good life. And I don't think that that's too much to ask. It's now year 2024, and we have to continue to close these gaps that exist. They're huge, they're far apart for First Nations people in our communities, and you'll hear from our leadership today of their plight as we work towards closing some of those gaps, and this is a big piece of it. So I want to thank, I want to acknowledge that we are on the Algonquin and Nishnawbe territory on where Ottawa sits, the people here that have welcomed us here in a good way. I've also like to acknowledge Chief Wesley, Chief Sylvia, Metatawabin, Evelyn, who's Korkmaz, who's also here, alongside Lynne Innes, Grand Chief Fiddler, Regional Chief Hare, Grand Chief Friday, and I also want to acknowledge our Deputy Grand Chiefs. Thank you for being here and for making your way here to Ottawa. Unfortunately, we have to do this once again, and I want to thank you for your support for our people here, and I want to ask you to come and stand with us to our Deputy Grand Chiefs. We're stronger together, and we are stronger when we stand together. So with that, I'm going to pass it off to our chair, and thank you very much to the media for being with us here today. Miigwech.
Thank you, National Chief Woodhouse. I'd just like to introduce myself as well. My name is Dr. Elaine Innes, and I am a family physician and also the Chief of Staff at the Weeneebayko Area Health Authority. I'm also a member of the Moose Cree First Nation. Next, I'd like to turn it over to Lynne Innes, who's the President and CEO of Weeneebayko Area Health Authority.
Thank you, Dr. Innes. Good afternoon, everyone. Thank you for being here today. My name is Lynne Innes, and I'm the President and CEO of Weeneebayko Area Health Authority and a member of Moose Cree First Nation. I stand before you with a heavy heart and a firm resolve to address a critical issue that threatens the health and well-being of our communities and our people. As many of you are aware, the federal funding for our much-needed redevelopment project was not included in the 24-25 federal budget, a decision that carries grave consequences for our region. Our flagship facility, Weeneebayko General Hospital, in Moose Factory was built in 1950. It's the oldest non-renovated hospital in Canada. It was built as a tuberculosis sanatorium where countless children from Northern Ontario and the Northwest Territories were taken from their communities and infirmed in an isolated facility on an island away from their families, their homeland, their language, and their culture. Today, this hospital, with its deplorable facility condition index score of 0.69, has long surpassed its intended lifespan. Our elders and community members, many of whom were subjected to the traumatic experiences I just mentioned, continue to face re-traumatization and reinstitutionalization as they receive care in this dilapidated environment. It's not just a building. It is a symbol of the enduring colonial legacy that our people are forced to confront daily. Since 2010, WAHA has been committed to serving the people of the James and Hudson Bay region. In 2007, Canada committed to funding our project for 45% under the Weeneebayko Area Health Integration Framework Agreement. Despite this commitment, the recent budget announcement failed to include necessary funding, jeopardizing the future of our project, and more critically, the health and safety of our people. Significant progress has been made towards this new health campus, with over $50 million already invested in planning and design. Contracts have been awarded, construction has commenced, and our communities have rallied in support. The abrupt withdrawal of federal funding now places these efforts and the economic and health benefits they promise in severe jeopardy. Let me be clear. We meet frequently with representatives from Ontario and Indigenous Services Canada, and at no point did anyone representing Canada ever indicate that the federal government would not be fulfilling its portion of our agreement. Our current hospital is in dire condition. It is not just an old building. It is a crumbling structure with a leaking roof, an antiquated boiler system, and inadequate facilities that fail to meet basic health and safety standards. We cannot continue to provide care in an environment that poses such significant risks. Where does this leave us in 2030 if nothing changes? It leaves us without a functional hospital, without proper care for our people, and without hope for our future generations. We have immense support from so many of our system partners, including over 100 of my colleagues, the Ontario Hospital CEOs, who submitted a letter of support, the Ontario Hospital Association, and countless other system partners and advocacy groups. I also want to thank the Government of Ontario, Premier Ford, and Deputy Premier Minister of Health Sylvia Jones for their unwavering commitment to our project and our local health system. I also want to thank our local leaders, the Grand Chief of Alvin, Fiddler, the Grand Chief of Mushkegowuk, Leo Friday, Chief Sylvia, Koostachin-Metatawabin, Chief Liz Katakwapit, who couldn't be here, but Evelyn is here in her place, Koostachin First Nation, Moose Cree First Nation, Chief Peter Wesley, and the Mayor of Moosonee. Their advocacy on behalf of their people is truly appreciated and needed now more than ever. I will note that those supporters I just mentioned have all received responses to the letters they sent to government. But as of this morning, we have not. I do want to note that the responses that have been sent do not include firm commitment that our entire federal contribution for our project will be provided in a timely manner. As a First Nations-led organization, the silence from Prime Minister Trudeau and his government is a harsh reminder of the systemic racism and broken promises that continue to plague our country. What other conceivable explanation could there be for the abrupt revocation of funding for a hospital in dire need of replacement, especially one serving marginalized and racialized Cree communities? This act undermines the very essence of the truth and reconciliation and disregards the urgent healthcare needs of our people. We all know this is about so much more than building or infrastructure. It's about providing quality and culturally safe care for communities who far too long have been subjected to less. Prime Minister Trudeau, we call upon you to honor the commitments made under WAHA. We urge you to provide the necessary funding to ensure that this vital project proceeds without further delay. The health and safety and dignity of our communities depend on it. Miigwech, thank you.
Thank you, Lynn. At this time, I'd like to invite from Moose Cree First Nation, Chief Peter Wesley.
Thank you, Dr. Elaine. Thank you everybody for being here this afternoon. Welcome each and every one of you. My name is Peter Wesley. I'm Chief of Moose Cree First Nation. You know, as I made my way here from my home of Moose Factory, where this hospital is located, the Moose Factory General Hospital, and having seen this hospital daily, day after day, and the conditions that it's in, it's really, really sad that we have not heard from our treaty partner, Canada. Canada has an obligation to its treaty partner, to the First Nations of Treaty 9. You know, as I was thinking about it, had a lot of time to think about it on my drive here. If this was strictly a health and safety matter, this building would have been closed a long time ago. There's no other hospital where you walk down a hallway and the roof is caving in. This is where our people go to receive a basic human right, health care. And they're expected to go and heal in this building. It doesn't work, it won't work in this current condition and going forward. This building is 75 years old. And we need the government of Canada to honor its obligations to its treaty partners in the Treaty 9 area, Albany, Koostachin, Moose Cree, and the other First Nations in our Mushkegowuk Tribal Council area. It's really, really sad that the only response that I've gotten to date from our treaty partner is a cursory response letter. No commitment, no details, other than, yes, we're working on this. There's an opportunity here for Canada in the fall economic statement, to correct this wrong. Even better, to correct it before then. The sooner the better. Because we have already started the ancillary billings that go along with this project. Those are underway, with the hospital itself soon to follow. And to get a call from IFC and First Nation Inuit Health Branch on April 30th, and to be told Canada is not honoring their obligation. Canada is not committing to this project. It was a disappointment and discouragement, and I had a few days to ponder that. It reminds me, once again, as I thought about our young children back home, the Jordan's Principle scenario playing out again, playing out yet one more time. Not only our children, our elderly, and our other community members. Canada, we need you to step up. Prime Minister Trudeau, we need you to step up. And today I invite you to come to our community. If you don't believe us, we have pictures all over this building showing the conditions of the hospital. I invite you to come to our community to see firsthand for yourself. If that's what it takes, then I invite you today. You have my formal invitation as Chief of Moose Cree to come to Moose Factory and see this hospital and the deplorable condition that it's in. It simply cannot stay as this going forward. This would not be tolerated in any other urban community. This would not be tolerated in Ottawa. This would not be tolerated in Toronto, Sudbury, any other urban center in Canada. Why do we have to tolerate it as First Nation people? Canada, where are you? This cannot continue. We need you. We need you to step up and be our treaty partner. Honor your obligations under the treaty. Again, I invite you to come. Come to our community and see for yourself. If that's what it takes, so be it. Come. You have that open invitation to attend. Thank you.
Thank you, Chief Peter Wesley from Moose Creek First Nation. At this time, I'd like to introduce Chief Sylvia Koostachin-Metatawabin from Attawapiskat.
Good afternoon, everybody. My name is Sylvia Koostachin-Metatawabin, and I'm the chief for Attawapiskat First Nation. I'm going to address my time in Cree because it's important for people to know that our language is still thriving. Our language is who we are, and it's important to remind people that ote amadete mahastige gaman bamatasun. Twendagon ashi chnani buyik mamo chnani buyik twitamo ichugamag kan debnach was ashi gnesho magadistano gishnagasanano egitamaga Mestedashin Napogatinimanog, Michelle Gabbage, and Otebini Omatiskeon, Mesebogatiskeona, then Dagon Magashinibu, Mesegana, Omagashi Hagoikas Tugamog, Monanamashigashin even, Betan Opposition Tugamo, Pagitina Shuniana, Mesegon, Onitamanestote, Aski, Kashi Staich, Kinano Shomagatiskinano. Kinano ashitamaga na giminagonano. Kinano depende na nagapamatasul mo ni nagastugamog. Masego magabihtig. Kone gashiga na han nasusustach mastede na han shaga maten dagon jami kishiwi kigonitiyik. Mashko masewi na testamago bishiga yagutigi Kashigisho to Garmaginistan Gishnagasi because Kinana Giniganistano, Kinanoskitano. Oh my gosh, Hagig, Monomagashnagan Ibanashi. Ashinin Stem Nishigiten, Mesegan Wapataman, Eka, the Bay Shinaga Kapamatasunano, Kashinaga Kupanash the Magion of Tehe. Ego Begash the Magion, Manapamatasun. Kitano mamo chimote juta mamo chipasagoste mahomagashi estai jutaski tendago maganos na mazulte maganos egon ni ishiganabat mame sege gona kino magenog tendagon chinani poe khashoge gona monabat no de zibidi tano chi pogostain is to pogosein minge gon ashi chimesuagaben tabo gaite to ashi nishitna Nishitina, oh, okay. Nishitina, I forget now. Anyways, I'm going to shago botin now, Hashi West could shago to Hogegona, Motemagon, I'm going to mante benafuni tati. You know, it's important when we're addressing a lot of the stuff that we speak in our language because our language is who we are, and when we make statements like these in our language, I'm sure a lot of people will not understand a lot of what I'm saying, but you know, anywhere else, they have translators for this. And we're the first peoples, and our languages are very important. And what's happening to us today should not be happening. Why should I have to come and stand before here when I have an inherent rights, when our people are inherent rights? You know, this is one of the treaty promises and obligation is health care. And we shouldn't be here coming over here if this liberal government is always saying reconciliation. Well, for my community, and I always said this, reconciliation has yet to happen because they haven't heard our truth. You know, they haven't heard our truth. Attawapiskat declared state of emergency on a humanitarian crisis in November 22. And it's a basic water, infrastructure, and housing that are immediate urgent needs. And it's far too long and it's far too slow. And the ATR process, acquiring additions to reserve, that's a joke. You know, we have land and we're ready to build, and yet we're being subjected to colonial processes that is really discriminatory and racist, just like our health care. There's a lot of things we can say about the quality of care that we're getting. It's still not up to par, it's still inequitable. We have personal stories, and I have my personal stories too. And it's tragic. A lot of my community members say when they go to Kingston or when they're being sent out to Moose Factory, a lot of our elders, our sick members, come home in coffins. You know, it's pretty sad. Since I became chief, every month, steadily, death. Tragic. And we need to do this. And I'm calling on Canada to come to the table. We need to talk. If you're serious about reconciliation, come to the table. We're all here. And yet, you're talking about partnership. You're talking about reconciliation. This is not reconciliation. Mingash.
Miigwech Chief Koostachin-Metatawabin. As mentioned, Chief Elizabeth Cataquapit from Fort Albany First Nation was unable to be with us today. However, she has sent Evelyn Korshen to share some words on her behalf.
As the proxy for Chief Elizabeth Cataquapit of Fort Albany First Nations, my name is Evelyn Korkmaz. And I am urgently calling for your attention to the critical need for the federal government to honor their commitment to replace the 1950s tuberculosis Weeneebayko General Hospital located in Moosonee, Ontario. The government's failure to include the promised new hospital in the 2024 and 25 budget is an issue that cannot be overlooked and demands immediate action. Our communities on the west coast of James Bay are in dire need of a modern medical facility. The cost of airlifting patients to Timmins, Sudbury, and Kingston are straining our healthcare system. The lack of essential medical equipment is compromising the quality of healthcare services in our area. Canada needs to fulfill their legal commitment and provide the financial resources to allow this project to move ahead so our family, friends, and loved ones have an up-to-date hospital that meets today's standards. It would not only save costs associated with air ambulances to distant hospitals in southern Ontario, but also would eliminate the need to travel expenses for accommodations, meals for translators and caregivers accompanying the patient. We are not talking about a 15-minute ambulance ride to the hospital. Patients are being uprooted from their families, familiar surroundings, and support networks, and serviced in unfamiliar language. intensifying their vulnerability conditions and resulting in immeasurable human cost. Access to proper healthcare services in our community is critical for the well-being of our people and the long-term cost effect of the healthcare delivery. I urge the federal government to move forward and honor its commitment to establish a modern hospital that meets present-day standards. Providing proper healthcare service will have long-term benefits that cannot be overstated. I implore the federal government to convene at the negotiation table to address this pressing matter. Thank you.
Thank you, Evelyn. I'd like to invite Grand Chief Leo Friday to come and share some words.
Wajik, Mingwest, Dr. Elaine Innes. Nimichiluesina Eni Boyano Tamina. Ebeche Ayamista Morgik. Eliluak and Duentekik. Kamilojnik Milomatis Yun. Pimatis Yun. Tandibugo. Kegi tutamach, tandene stabo kegi switchiak. Hanuchka betama kegon te bachamwen. Na spigi melotagon uben. E masno tusien. Ke gawichika puislatinan. Ke kamintinan. Kegon gandoen tamek. Ke teliloski muach. Ke tetaonoach. Tantabu geishe. Wawane paliek. Kamindinan, kito bang getsugamau, amigot, nitilimanani, may gosan and magagi beji papa mutin, papa lutamayan, nascometun, nesta wichigos yun, nesta kigise melopimatet tain, meswege gona, uta eteke Canada. Anutsmaga, Munan Yusiden de Temina de Tagushanan, Utachibeche, Nanu Tagusian, Egomagan and Miss Chiluesan, Mina. I once again appeared in this stage. Last time it was 2005 in October, and then 2007 in April. And then in 2017, in March, and again in 2019. And today, I feel it is not right to do this all the time. I think for us, for you, to think about from henceforth, is to work with us like what your people are promised back in the day when our great-grandfathers was talking and discussing about the agreement that you wanted our land. And today I feel this grace and very hard. I would expect Ontario to resist, but I would expect no trouble from the feds, Canada, or Liberal government. You as a leader, Prime Minister, as leaders of our nation, we stand here not only to demand the federal government honor. It is a commitment to funding our new health campus, but to uphold our inherent rights to an equitable health care. Our presence today signifies our unwavering dedication to the well-being of our people, echoing the voices of our ancestors who fought tirelessly for justice and sovereignty. We are here to ensure that promises made are promises kept for health and dignity of our communities. And furthermore, Mr. Prime Minister, I am here for the people we represent. There are 15,000 people in our Mushkegowuk, Weeneebayko region that we voiced out today, whole and very young. Minister, the Honorable Paddy Haite, you made references of the shared priorities in the department results reports 2021 and 2022. Shared priorities from the action plan implementing United Nations Declaration on the Rights of Indigenous People Act. One of the shared priorities to addressing injustice, prejudice, violence, systematic racism, and discrimination. How are you and your department addressing these when you and your department is advancing by not fulfilling your promises? Mr. Prime Minister Justin Trudeau, we invite you. We want you. We were happy when you take leadership for Canada. And now we are sad the way you're treating our people. It is not right. Please make the wrong to be corrected. Thank you.
Thank you, Grand Chief Leo Friday of the Mushkegowuk Council. Next, I'd like to invite Ontario Regional Chief Glen Hare.
Now, miigwech, gwen gos gain dis na kas chigging donji chigging jint kade na don sing. Gemaden kidman gonan jindagini Ontario kade. Good afternoon, everyone. My name is Glen Hare. I'm the Ontario Regional Chief. I'm from Chigging First Nation, Manitoulin Island, the Ontario Regional Chief, and I just want to acknowledge the Nishnawbe territory that we're on here today. So I'm here today again to support Weeneebayko Area Health Authority and seeking the Minister Haru's commitment to working with and fully supporting WAHA on their redevelopment project. WAHA's development project is a once-in-a-lifetime project that can transform and improve health outcomes to all First Nations citizens and residents of the Western James and Hudson's Bay Coast. This project will result in a new regional health campus that will include an acute care hospital, a long-term care home, a patient hostel, and safe housing. This is significant upgrade to the current facility, which was originally built 74 years ago. The current facility has been outdated since the 1980s and has been under constant state of disrepair since. But lack of federal government responses puts this project in jeopardy, and this can negatively impact the health and wellness of residents of the Western James Bay and Hudson's Bay coast in the long term. This is not a new project. This is from 2007. And under that, the agreement was signed by the government, and under this agreement, Canada committed to contributing 45% of the project cost for the new regional health campus. I also I have to share April 2nd myself, and these are experiences, and I don't make up what I share with the public. I was hospitalized for 12 days of April 2nd. The general public, eyewitness in my room, who are patients, took for granted what the nursing staff, how they treated him. I looked, I watched, because he was in my same room, the patient. I could only wish our people, half the care he was being given that he wasn't appreciative of, that our people could get. Half of that. This is what we mean when a lot of things are taken for granted and things that we have not experienced. And those are the very truths. So it's a sad reality that we have to gather here again today after so many years. And what's it going to take? What is it going to take? The complete collapse of literally of this hospital? I hope not. So to the minister, to the government, its services, we talk about reconciliation. All of us heard reconciliation since residential school, day in and day out. We want to see it. The people want to see reconciliation, not hear about it. Every time we come here, reconciliation, reconciliation. Let's see it. Let's do it. As the chief said, let's fix it. And if there's a commitment signed, we as leaders, we know what that means. So to the government, to Prime Minister, yes, go see it, if that's what it takes. If you see it, it will say 1,000 words, and you'll probably cry too. Go in the hospital and see the patients. So it is in that case, so Minister Hare needs to follow up, Minister Patty Hare, through and with the notion and publicly commit to the partnership with WAHA and their redevelopment project and follow through on their fiduciary obligations to this project. Miigwech.
Thank you to the Ontario Regional Chief for your words and support today. Next, I'd like to invite Grand Chief of the Nishnawbe Aski Nation, Alvin Fiddler.
Miigwech. Good morning. I forgot my watch at the Thunder Bay Airport this morning, so is it afternoon or morning? I just want to acknowledge all of you and thank you for being here. I also want to acknowledge the leadership that's behind me from WAHA and from Mushkegowuk, from Chiefs of Ontario and also from the National Chief's Office. Thank you for joining us here today. I was telling the group earlier this morning that I was a bit angry coming here. And it's not because I had to get up super early this morning to catch a plane to come to Ottawa this morning. It's because that we have to do this. That we have to do this press event, traveling hundreds of miles from our communities to implore Canada to follow through on what they agreed to back in 2007. That's 17 years ago when they signed the Weeneebayko Area Health Integration Agreement. That was agreed to by all the parties, including Ontario, including Canada, including our communities from Mushkegowuk, to improve health and healthcare in that region, including building a brand new hospital. And it's not just a hospital, it's a health campus that will include long-term care, that will include residences for the people that will be working there, nurses and doctors and other health professionals, to include ambulatory services, to have everything that almost every other hospital in the region has. And that's why I was a bit angry. That we have to write letters, and believe me, we've written so many letters the last month and a half from the leadership, from NAN, from the national chief, from the Ontario Regional Chief, asking Canada to at least acknowledge what we're telling them, that they need to step up and honor the commitments that they made back in 2007, that they would bring the money necessary to build this hospital. And while all the other partners are moving forward with their own commitments with WAHA, and you heard earlier about Ontario, following through with their share of their commitment to this project, Canada is just nowhere to be seen. They don't even acknowledge our letters. Or if they do, it's a very generic response that we are looking into it. There's things happening that you have to wait for. Maybe something will happen later on. Well, that's not good enough. You know, there's some legal obligations that WAHA has. There's some critical dates that are coming up, or maybe have come already, that if there is no commitment from Canada to actually nail down this project, that people will start to walk away. That the contractors, the banks, everyone is getting nervous. And when that happens, this project will not happen. And that's the reality that the leadership from those communities, the 15,000 people that live in that region, that's what they are facing right now. And that's why we're here, to ask Canada to not only do the right thing, but to actually fulfill what they committed to our communities back in 2007. I was in Attawapiskat a few days ago, on Friday, and they spent 3 days last week, Monday or Wednesday, Thursday, and Friday, to talk about their healing and wellness, to do planning on how to make their community a healthier place, a safer place for their children, the 2,500 people that live there. And while there are many challenges that exist and that need to be addressed at the community level, the regional planning that is taking place in communities like Attawapiskat need to include a hospital. A hospital like what we're talking about here today. A center of excellence that will serve the citizens in that region. And I remember going to Attawapiskat a number of years ago, and I met this, I think she was maybe 7 or 8 at the time. Her name is Marcy. This is a few years back. I think 2018 or 2019. And I remember going there with the then IEC Minister, Seamus O'Regan. We landed there, and we go to the meeting, and there's this little girl standing right in front of us with a sign that they had made talking about her own personal challenge as a child living in that community that has no water, or that has no access to clean, safe drinking water. And she said, I need water. I only have 1 kidney. And when I was there on Friday, I made a point of tracking her down. I went to her school. I went to her classroom, and I saw her, and I was able to spend some time with her. And she said, I'm still waiting. I'm still waiting for the clean water that I need to keep me healthy. And she's now 13 years old. And so when we come to press conferences like this, it's to remind Canada to end their discrimination against our children, including Marcy Wesley. That you actually need to step up and honor these commitments that you've made. Enough of these empty gestures. You know, the leadership talked about what we've all heard. The Prime Minister say that there is nothing more important to me than the relationship I have with the Indigenous people of this country. Where they talk about reconciliation, that they want to right the wrongs of the past. Well, this is your opportunity. And I understand that there's going to be, later on this afternoon at 4:30, an economic reconciliation roundtable that's going to happen here in Ottawa. Minister Freeland is going to be there. Minister Patty Hyder is going to be there. Other officials from Canada will be there. And if you're serious about reconciliation, then I would ask that you invite the leadership from WAHA, the leadership from Mushkegowuk, and also to accept their invitation to visit their community in June. And that's why we're here. Miigwech.
Thank you, Grand Chief Alvin Fiddler. At this time, I'm going to invite Cindy Woodhouse, National Chief, to come and make some final remarks.
Well, thank you. I think you've all heard right from our people that are on the ground that are facing this crisis right in front of them. There's 15,000 people that are affected by this, by a hospital, that infrastructure. Again, of course, we have a $349 billion infrastructure gap in this country. I know that that's an uncomfortable number that we continue to talk about here, right across the country. But it's important that we start working together to close these gaps. And this is just one project that needs to be completed. 15,000 people depend on it. As you can see, through the photos in the hallway, that this is a crumbling facility. And it's one of the oldest hospitals in Canada that has never been renovated, never been upkept in a good way to meet today's standards. It's a very old facility, and it's a very colonial facility that has hurt our people in the past. I want to commend Ontario for being a part of this project. The province of Ontario, thank you for your commitment to this. Now we need the feds to come back to the table. I know that they've been, I'm hoping that they come up with their portion. And I think that's a fair ask from this group that thought that they had an agreement from way back from 2007. It's now 2024. This facility needs to get built, and it's a lifeline for 15,000 people. So let's put our hearts, our minds towards that. I want to thank you for being here today. I stand with each and every one of you, with all of our First Nations communities in Northern Ontario, as they push for the people of Northern Ontario to have a good hospital that services many, many people in that area, First Nations and non-First Nations alike. So thank you for this, and I'll pass it back to the moderator for questions and answers. And thank you for joining us here on the Algonquin and Nishnawbe territory here in Ottawa today. Thank you. Miigwech.
Hi, I'm Gabriella Kaluga-Kisuga at the Globe and Mail. I was just asking why you think the feds did not include funding for this project in the federal budget this year.
Could you repeat your question, please?
Why do you think this funding was not included in the budget this year? Why do you think the feds chose not to include it?
I would hope that's the question you should be asking the federal government. That's why we're here, is to find out why they are choosing not to honor their commitments, that they've made an legally binding agreement. And so I hope you call them and ask them that question.
Do I get a follow-up? Okay. And I'm just wondering if they do correct this situation, right this wrong, as you said, what figure would you expect to see for funding from them?
So the projected figure that we expect to see from the federal government right now is $1.34 billion.
Go ahead.
My name is Carrie Slack with APTN. My question's more on feeling than funding. So we keep showing up, as Canadians, we keep showing up to do all these performative duties, like tell you that your approval process is going through, and groundbreaking ceremonies. How do you feel that the government's not following through on that?
Do you want to take this, Lynn?
Do you mind repeating your question?
Sure, I'm not sure how to word it exactly, but Canadians keep showing up to say that, you know, this has been approved, stage 2 has been approved, we've had a groundbreaking ceremony. How do we justify showing up performatively, and how does that make you feel?
Well, I think they need to fulfill their commitment. They made a commitment, they need to fulfill it. We've been a good partner. The ministry of, the provincial ministry has been a good partner. So the feds need to show up and fulfill their commitment. Thank you.
Thank you.
Hi, sorry, Christy Kirkup, also with the Globe and Mail. I'm wondering, this dates back to the 1950s, the current hospital. What do you think it means, or what have you heard from elders who perhaps had to go to that hospital to receive care for tuberculosis as children, who now have to go to the same facility today to seek medical care?
So I think, you know, for a long time, they almost see it as reinstitutionalization. They were taken away. Some of them were children and were taken away and taken to this hospital on an isolated island to receive TB care. And they were kept there until, you know, they were cured or well enough to go home. And then, you know, it's the same thing that we're kind of doing at this time. A lot of the patients that come to the hospital, you know, they're there for treatment, but the state of the hospital and, you know, the things that we have to do to provide good care for them is just not acceptable. If you don't know where we are on an island in Moose Factory. The majority of the time, we don't have transportation to and from the hospital. We service 5 coastal communities, so they have to fly to our community hospital to receive care, so they actually have to leave their community. We struggle with providing specialty services. We can no longer provide obstetrical care because we don't have the health human resources, which means that the furthest community, which is Pewanik, they have to leave their community and fly all the way to Kingston so that they can have a baby. You know, this service should be available in our own hospital, in our own community. Now, granted, you know, Pewanik is still far from Moose Factory, but, you know, this would be in an Indigenous community, an Indigenous-run hospital, where most of the providers are Indigenous. You know, that's what they need, right? So, you know, there's a lot of things that we could talk about where, you know, they receive less than equitable health care in that region. And as a family physician and someone who's worked there for many years in various capacities, I've seen this. I've seen the state the hospital has come to be, and I think this is not acceptable for anybody. And like Chief Wesley said, this wouldn't be acceptable in the South. This wouldn't be acceptable in Ottawa. This wouldn't be acceptable in Toronto. So why is it acceptable in Moose Factory?
You mentioned individuals can't give birth at the current hospital facility.
Mm-hmm.
At the new campus, should there be funding to move ahead with the project? You know, the timeline's towards 2030, right? Would there be an ability for people to give birth at the new facility, should it ultimately be built?
Well, that is the goal. That is the goal. We hope with the new health campus that we will increase our services, not only specialty services, we also want to have our birthing center open as well. We'll have more beds, we'll have a long-term care facility, we'll have primary care, we'll have, diagnostic services that are not currently available at our old hospital, in our new hospital. And then, the issue with transportation is going to change. The airport is on Moosonee, it's on the mainland. In order for patients to get to Moose Factory, they have to take a helicopter across during what we call shoulder season, so when the river's freezing up or breaking up. And if there's no helicopter available, then we're stuck with nowhere to go.
Wow. Thank you very much.
You're welcome.
Hi, I don't know if I missed it earlier. I'm just wondering how many of your services you're outsourcing now as compared to before?
Well, we do have specialty services. We have a long-standing relationship with Kingston General Hospital, so a lot of their specialists come to Moose Factory. And that is our goal, is to provide care as close to home as possible. So we are continually engaging with specialists from the south, predominantly Kingston, to come and provide those services at our hospital. And that's why, we're busting at the seams. Our primary care clinic is busting at the seams, and we have all these specialists that want to come and provide services there. So we don't provide obstetrical services, but we generally do provide a lot of services at our hospital, and we hope to expand.
Thank you.
Okay, so we'll have some time for some one-on-one interviews, but I appreciate everyone coming out today and listening to what our leadership has to say. Thank you. Thank you.